I am Vamsi Mohan, and he is my father-in-law, Mr. S.V.S. Murthy. He's been diagnosed with a couple of brain stroke. The first one happened in 2019, then later in October 2020, and within a very short span of 3 months, and February 2021 again. Where he's been a patient of Mr. Shailesh Modi in Queen's NRA, Visakhapatnam, and with the latest 2021 stroke, he's been referred to Dr. Dalai, where he was done a DSA test, and Dalai sir said it's about 99% blockage in the left side, and he needs stenting immediately. And that's how we came to Dr. Dalai. The overall experience, I would say, has been perfect. Mr. Dalai gave us good enough time to think over to digest and think over what he said the diagnosis is, because it's totally new for us. So gave us time. He gave us material to study to understand what the problem is, and he gave us enough time to explaining us what the procedure would be and everything. And I'm happy that I got my family and everyone convinced to get the procedure done here in Medicover from Dr. Dalai. Thank you very much.
Brain stroke happens because of lack of blood supply to the brain. And that can happen because of a rupture of a blood vessel or a blockage of the blood vessel. The blockage of the blood vessel is called an ischemic stroke, and bleeding in the brain results in a hemorrhagic stroke or brain hemorrhage. Now, 90% of all stroke that we come across are ischemic stroke because of the blockage of the blood vessel. Out of that, 1/4, 25% of all acute ischemic stroke and ischemic stroke per se are because of carotid artery disease. Now, what is carotid artery? Carotid arteries are two major arteries, one on the right, one on the left, which goes into the brain. They are the major supply of blood into the brain. And these carotid arteries are prone to have plaques or blockages because of diabetes, atherosclerosis, old age, and hypertension. So when there is a blockage of the carotid artery, then the patient can land up with stroke because of lack of blood supply, or this plaque, which is slowly depositing over the carotid artery, can rupture and occlude a brain blood vessel, resulting in stroke. So these carotid artery disease are traditionally treated with medication if they are low grade. If they are higher grade, more than 60 to 70% stenosis is there, then we can do endovascular procedure called carotid artery stenting. So previously we used to do a surgery called carotid endarterectomy. Now with advancement of technology and medical sciences, we have a better procedure which is minimally invasive called carotid artery stenting. So we have done a carotid artery stenting in our patient, Mr. Murthy, and he is doing absolutely fine. We will share a couple of images how a carotid artery stenting looks like. Thank you.
I am S.V.S. Murthy. I am a patient of Dr. Dalai, who operated me successfully, and I consider